So today I am doing male sterilization, otherwise known as vasectomy. This is a male-only method. Um, it's used to prevent pregnancy, not STIs. Just because of the way that the procedure is done, they go in and they cut the vas deferens, which prevents sperm from entering seminal fluid, which then enters the vaginal canal. But that you still have that seminal fluid, which is where the microbes would be if you did have an STI, so you can still spread that. This method is fairly inexpensive, so around $350 to $1,000. However, most insurance companies do cover that cost, or at least partial cost. It's a long-term method. This isn't considered something that you would do and then have undone, though it is reversible. However, that reversal is really expensive, it's extensive, and it's not 100% guaranteed effective. And it can run anywhere between $4,000 to $15,000, and that isn't actually covered by insurances, well, most insurances. So that is also considered a disadvantage, is that it's not reversible, so it's permanent, which another disadvantage is that sometimes people regret that decision, especially if they're younger in their 20s and they've made that decision. They can't really go back and undo it and be successful. However, on the flip side, this method is actually very effective. It's around nearly 100% effective and better than most, so it's considered the most effective besides celibacy, which is not having sex at all. So how does this work? I will show you a picture. So here in this picture, you can see the vas deferens were severed, and then they tie them off, or they cauterize them, which means they just use heat, which will then glues it together. And I have an actual picture of a vas deferens here. And here you can see where it was sutured. And here's a scrotum, and then they just put it back in, and then they cauterize that closed. And another picture here. And this is just kind of like step by step exactly how they do it. So they open it up here with the scalpel. They go in and cut it. Then they go ahead and suture it back up and cauterize the scrotum closed. They can also use this method to do the sutures here, but instead use the cauterization. And so, like I said, this is very effective method, and so what they do, to be more specific, is both of the vas deferens are what this they're the tubes that the sperm will no longer be able to pass through and be ejaculated with the semen. And so a small incision is made in the scrotum, and then they go in and they cut each of the vas deferens, and then they either tie them off or cauterize them, and then they go ahead and then just suture it closed or cauterize the scrotum closed. It's a pretty quick, painless procedure. I mean, there'll be some pain, but pain management is very minimal. It's not very invasive whatsoever, so your post-op time is going to be fairly quick. It's outpatient. A man can still ejaculate and have orgasms with this. His semen just won't contain the sperm, which is what would, cause the pregnancy in the first place. If I were to give two pieces of advice, the reason why it's not 100% effective is because there is still human error. There are post-op instructions that you have to follow if you want this to be very effective. You need to go in and submit 2 to 4 months after you have your surgery. Go in and submit a semen sample, and you need to have at least 20 ejaculations non-vaginal, and so after you have the surgery. And this is just to ensure that you've kind of flushed all of that sperm and semen through the vas deferens and that everything is all cleared out. So another piece of advice is to use protection during that time. You don't have to not have sex. You just have to make sure you use a backup contraception if you don't want to get pregnant. So compliance to those post-op instructions and making sure you go to your follow-ups is very important, and just to be patient, because once you have gotten through all of that, it's such a very good and effective contraception um, that you could have. And I think that is all for now. So if you have any questions, you can just leave them in my post and I can try to answer them for you. Thanks.